This is Mayor Trey Mendez. I want to welcome you all to today's edition of BTX Cares. It's a medical edition, and we're dealing with those individuals that are on the front lines of the COVID pandemic. And I'm happy to welcome the panelists today. First off, we've got my co-host, Commissioner Jessica Tetreau.
Good morning.
And Commissioner Tetreau has been the Commissioner of District 2 since 2011. So thank you, Commissioner, for joining us. Next, we have Dr. Asim Zamir. Dr. Zamir is a board-certified pediatrician, and he is a Chief of Staff at Valley Regional Medical Center and the Chief of Pediatrics at Valley Baptist Medical Center. Welcome, Dr. Zamir.
Good morning. Thank you, Mayor.
Thank you. We also have Dr. Juan Garcia. Dr. Garcia is a board-certified family physician. He's fellowship-trained in functional medicine. He currently works in Brownsville, Texas, and 7 other locations, and specializes in family medicine. Dr. Garcia, thank you for joining us. We also have
Thank you.
Thank you. We also have Dr. Jairo Rodriguez, who is a board certified in critical care. He's a pulmonologist, an intensivist, and he has credentials at Valley Baptist Medical Center in Brownsville and Harlingen, and owns the Benchmark Pulmonary Group here as well. Dr. Rodriguez, thank you for joining us, sir.
Good morning. Thank you.
Thank you. We have Dr. Geraldine Mullane, who is board certified in emergency medicine, and she is in the ER Valley Regional Medical Center. Dr. Mullane is an emergency medicine specialist, and she has been practicing for 27 years. Dr. Mullane, thank you for joining us.
Thank you very much. Good morning.
Good morning. And last, we have Dr. EderHernandez. Dr. Hernandez is a physician assistant, certified, nationally board certified physician assistant. He is a chief PA at Valley Med Urgent Care Centers, Brownsville and McAllen. And Dr. Hernandez is in case you didn't know, he is in charge of our drive-through testing and helped initiate the drive-through testing here at the sports park for the city of Brownsville, and is doing a lot of great work there. Dr. Eder, thank you so much for helping us put this panel together, and thank you very much for joining us today.
Mayor, it's a pleasure to be here this morning. I worked with all these physicians for over 10 years, and they're amazing. Brownsville is very lucky to have every one of these specialists on here today.
And I'm honored as well just to have such a great medical panel of experts and people that are really genuinely on the front lines. I felt it was important to give our citizens a perspective of what it's like out there, what's really happening, what all of y'all are seeing in your different specialties, and really have everybody realize the importance of everything that's going on, and most importantly, the seriousness of everything that's happening as well. Commissioner Tetreau, would you like to make any opening remarks?
I just want to thank everybody for being here. I know that the mayor and I worked really hard and quickly to put this together because we really want to just make sure that any information you have can be relayed to the community. I know that the mayor and I and the other commissioners get a lot of questions about COVID, and we do our best because we stay in contact with you all. But the best way to do it was to bring you all here and deliver you directly to the community. And we're so grateful because we know you have so many patients waiting for you right now. We're so grateful for your time. And I just want to remind the public, send in your questions. Our doctors are ready to answer them. Thank you.
Thank you, Commissioner. And on behalf of the City of Brownsville, Commissioner Tetreau as well, we want to thank everybody for tuning in. Our commission has been very proactive in trying to fight this pandemic. It's something that we haven't seen in probably about 100 years. We've seen this really grip the entire globe and have have long-lasting health effects and some very serious health consequences for those individuals that are out there. So thank you all so much for joining us. We'll get right into it. I want to start off with Dr. Eder. Doctor, can you give us a briefing on the drive-through testing initiative that's happening right now with the City of Brownsville and how we're doing on that, please?
Well, Mayor, good morning. We've come a long way. We put this project together in a little over 3 days. I'm going to share the screen here shortly to give you some of the numbers of what kind of run through the numbers for you guys. So I'm going to share the screen now. So you can hear me now?
Yes, let's start from the beginning.
Okay, great. So the drive-through testing center, we've had over 108 positives, 1,612 negatives. We've performed 1137 sputum samples and 700 swab samples for a total tested of 1,842 patients. So we've tested through our drive-through efforts, Mayor, 1,842 patients. Out of these patients, I've conducted follow-up visits with them on the positives and transferred the care over to the PCPs. For example, Dr. Zamir and I've recommended some of his patients that have been positive, and he's been taking over that care. Dr. Garcia as well. So it's a very fluid system, and we're very happy to have these physicians on here that are helping us, fight COVID disease. We screened 4,000 questionnaires. So out of those 4,000 questionnaires, 1,800 of those have been tested because of the CDC rules and guidelines and recommendations on symptomatology. At the beginning of the drive-through testing, we focused on the three major symptoms from CDC, which was fever, shortness of breath, and cough. We looked at what the European brothers and sisters out there were going through, and we looked at that some European foundations and societies, they were looking at in Italy, there was a symptom of loss of taste or smell very early in the disease. At that point, when we started the screening questionnaire, we added that symptom that was able to pick up lots of asymptomatics or early onset of disease. And just recently, we upgraded our questionnaire to include abdominal pain and diarrhea. And so we've been able to capture lots of patients with different symptoms, even including rash. Sometimes COVID-19 can present with a type of rash. And we're really taking all these considerations from different societies, the CDC guidelines to obviously get the best testing out there for the patients. We do perform an RT-PCR test, which is the most sensitive and diagnostic test for COVID RNA viruses, COVID-19. So we've done over 700 swabs. Most recently, we had our youngest diagnosed patient through our drive-through efforts was a four-month-old baby that we performed a nasal swab on, and that care has been transferred over to that pediatrician that was was happy that we were able to get the child tested. Any questions on the drive-through, sir?
Well, I do want to thank you for being innovative in the way that you've approached the symptom questionnaire for the drive-through, because I know that for a fact, you and I talk just about every day, and I know for a fact that having those different symptoms, those additional symptoms on our questionnaires has caught some tests. And I do believe that the most valuable part of having this drive-through testing so far has been keeping those individuals that have been tested at home, off the street, away from others, and that's helped us, I believe, contain some of this virus spread in Brownsville as well. So thank you, Dr. Hernandez, for that. I really do appreciate it. Commissioner Tetreau, you want to take the next question?
Sure. I guess it was a follow-up for Eder. I just have a real quick one. So the question I was supposed to ask you, you answered it very, very well. The evolution of symptoms, all of these new things that we're seeing. So I'll go ahead and ask you something real quick, a question that I've been getting a lot lately. Let's say that I am a person who might not have the correct status. I'm not a citizen. I'm not a naturalized citizen. I don't have any documentation. I have COVID symptoms and whatnot. Can I go test with you? Will I be turned away because I'm not properly documented in the United States?
That's a great question. We obviously through the drive-through system that you need to show some form of residency that you're part of the city of Brownsville. If there's any question in doubt, we have had those questions before. Our stance is we're here to service anyone and everyone that needs a test. So in that case, they're referred to the Cameron County Health Department where they're dealing with this type of issue. For our screening methods, you must show some type of Brownsville residence, at least some information that states that. But if that is not available, we're not interested to know your immigration status. We're interested to know if you have COVID-19. So we make the recommendation to the Cameron County Health Department for further guidance.
Thank you, Doctor. And I will point out also that for those individuals that want to know more about the questionnaire itself, it can be found on btxcares.com. For those individual residents of Brownsville that don't have insurance, the city of Brownsville is covering the cost for those individuals that are uninsured. Of course, if you have insurance, the provider is accepting insurance, but for those that don't, the city of Brownsville is covering those costs, and we want to try and find as many positives as we can, because the more we know about, the more we're going to be able to prevent the spread of the disease. So thank you so much. Dr. Jairo Rodriguez, with your expertise in pulmonology, can you discuss the different pulmonary issues that we're seeing amongst COVID patients and some possibly some of the long-term health effects that we're seeing as a result of it as well?
Yes, the problem with the COVID-19 in our population is focused more in elderly people. And why? Because they have many comorbidities, and patients that are presenting multiple comorbidities, that are elder, are coming to the hospital with the major symptoms that are cough, fever, shortness of breath, and many times these patients present symptoms so serious that require mechanical ventilatory support. And that is the major problem, because we realize that the case fatality rate is around 1.4% for people with COVID-19. But the case fatality rate increases with age. People that is younger than 9 years old, the fatality rate is less than 1%, and the case fatality rate for people that is older than 80% is nearly 8%. The hospitalization rate as well in young populations less than 10 years old is 0%. Meanwhile, for people that is 80 years or older is 18.4%. And that is the situation in bigger cities, that all of these people are admitted with the COVID-19, and they require mechanical ventilatory support at critical care status. And we found that the capacity of ICU for this kind of population is minimal, and for that reason we consider that we try to protect the elderly as much as we can. And it's a very controversial about the quarantine or no quarantine, and some people even is protesting these kind of situations. But I agree that to avoid this kind of plugging of the system, especially in the intensive care unit and emergency room with patients with COVID-19 that are seriously ill, we need to try to have this quarantine in place. Obviously, long term, the issue is what we're going to do with the financial system of our countries, and the world is paralyzed because of that. Sweden, for example, has been trying to do an experiment that is called herd immunity. They allow everybody to be in the street and try to allow people to get infected and to be able to continue with the routine as possible. Their fatality rate has been increasing in Sweden, especially in the elderly population. And at the end is a question of ethics. What is the best for the community and what is the best for the individual person? We have realized that nursing homes that have a large quantity of patients that are elder and that are with multiple comorbidities, they have a predisposition to have more people infected, and that was happened, we know, in Harlingen recently in 2 different nursing homes. And these patients, many of these patients went to the intensive care unit, and many of these patients died because of the COVID-19. What was going to happen if they didn't have the COVID-19? Probably some of these patients were going to die for other comorbidities, because they are elder, because they are immunodepressed, and because they have multiple comorbidities. But I consider that the mass testing should be done in the nursing home, and whatever you are doing with the community in the outpatient center is great. Whatever Eder is doing, and with the effort of the mayor and the city of Brownsville. I think that it is great because we are able to identify people that are possible asymptomatic and that are able to produce the infectivity increasing among the population. What we do with these patients that are in the intensive care unit is as well is a controversy. Too many controversial issues with these patients. We realized initially we tried to put the patient on mechanical ventilatory support, but we realized that many of these patients can tolerate the hypoxemia, the low oxygen levels. And we're trying to use different kind of systems. Initially we say no BiPAP, now we're trying to use BiPAP. We are using high flow oxygen, that is some kind of oxygen that we give in high amounts to the patients, try to avoid the intubation. When the patients go to require mechanical ventilatory support, the mortality increase because they require sedation, because they require feeding through the tube, because they are at high risk for hypotension due to the sedation that we use, because they have a risk to have decubitus ulcers. And we try to avoid that, but unfortunately some patients require the mechanical ventilatory support. Even we don't realize if we have only one kind of a pulmonary disease or are two different kind of patients that have the pulmonary disease. We don't understand really if everybody behaves like a adult respiratory distress syndrome, that is in the way that many patients with pneumonia present, or is a different kind of disease. And some of the patients require some high pressures. Many of the patients don't require high pressures. And we are trying to understand really how we can optimize the care for these patients in the intensive care unit. And again, controversy about medications is still there. We initially were using the hydroxychloroquine. People were trying to keep the hydroxychloroquine in high quantities hidden in some places. We realize now that a high dose of hydroxychloroquine don't work. I personally don't use it for this kind of patients. I still use the Citromax. It's controversy about Citromax. Now that the government approved the Remdesivir for these patients, apparently decrease the time of disease. The recovery is around 11 days versus 15 days, and the mortality decreased from 11.6 to 8% with the Remdesivir. But until now, I have not been able to use that. We are using the plasma for people that have been infected, very difficult to obtain. I think that we have used in the Valley in few patients, but I have been not used it myself. I mean that it's a lot of controversies, but we're trying to optimize the care of these patients as much as possible in the intensive care unit.
Thank you, Doctor. Commissioner, do you have any follow-up questions for Dr. Rodriguez?
Yes, Dr. Rodriguez. I just have a question. Let's say that my spouse or somebody that lives in my home has these cardiovascular issues. What advice do you give the patient who has heart issues and everybody in their household?
If the patient has cardiovascular issues, as I will advise to try to avoid contact with patients, to try to keep the social distancing, to try to use the mask, to try to use hand washing, with that the regular care that we use to avoid infection. And if it's people that is exposed to patients with COVID-19, I will recommend that they try to be away from the patients that have cardiovascular disease.
And I just realized I said cardiovascular when I meant pulmonary. Because you're the pulmonologist. Yes, sorry about that.
I'm a pulmonologist, yes. I'm a pulmonologist, yeah.
Yeah, sorry, but it's the same advice, right?
Yes, definitely. Yes.
Okay, thanks, doctor.
Thank you. Dr. Mullane, thank you for joining us. I want to talk a little bit about the ER perspective. Certainly the hospitals are one of our concerns at the very beginning of this pandemic was not overwhelming the hospital system. So can you give us a little bit of insight from the ER perspective, what it is that we're seeing symptom-wise, how the hospital's handling intakes as well?
Okay, yes. Well, we were very prepared very early on, having already seen what was happening in New York. HCA and our hospital here and Vision, our emergency group, mobilized a complete plan to take care of what we felt might be an overwhelming number of patients. Thankfully, we've not gotten to that point yet. We're well prepared, well staffed, and have enough PPE to accommodate. Now, in terms of the patients that we're seeing, we're actually seeing a whole spectrum. We don't know when they arrive in the ER if these are COVID-19 patients or not, because they're tested, and this testing may take several days to come back. But we're hyper vigilant with anybody with respiratory symptoms. And even if they don't have a fever at the door, if they felt like they had a fever, they're immediately taken to isolation rooms with negative airflow, negative pressure airflow. And they're seen in there with the staff in full PPE, including the N95 mask and the goggles and the gowns and the gloves and everything that's necessary for protection. We have one main entrance to the emergency department, and at that entrance we have people, we have staff in full PPE that screens everybody who comes in. Everybody who arrives gets a mask, first of all, for everybody's safety. If they screen positive for being suspected of having COVID-19, they are taken to a different entrance. They do not even enter in the same area that the rest of the patient population is entering. If we identify a person under investigation for COVID or a suspected COVID, and that patient is sick enough to require admission, we literally have security clear the shortest path to the area the patient will be going to, and following that patient's transfer to our isolation unit, that entire area, the entire path or journey that they took to that room is disinfected extensively. So what I want to put out there is that our other patients, certainly we want anybody who feels ill to come to the ER and be screened, regardless of your illness. We don't want people to be afraid to come to the ER and afraid that they'll be unnecessarily exposed to COVID, because that won't be the case. If we want the general population to know that if you're having heart attack symptoms and stroke symptoms, difficulty breathing for any reason, any injuries that are severe, any pain that is severe and that is distressing you, you need to get to the emergency department. The emergency department is not unsafe. We're well prepared. Okay. Any questions?
Commissioner Tetreau, do you have any follow-ups for Dr. Mullane?
Yes, I'm going through the comments to see. We have a lot of people that gave you a lot of hearts when you started talking, so that just tells us
Thank
love
you.
you in the community. But I just wanted to ask you, in the ER, are you seeing people show up that are very severely ill, that had not tested, people who are not getting tested but all of a sudden having onset symptoms? Are they showing up in your ER?
At this point, I still wouldn't know if such patients were truly COVID positive. But yes, like I said, we're seeing the gamut. We're seeing mildly ill people to very ill people, and some of which we suspect. We will now suspect anybody from a group setting with fever and respiratory symptoms or other concerning symptoms. We're seeing, now, we're very concerned with anybody in any group, such as nursing homes or detention facilities. And like I said, we're very hyper vigilant. In the event that we start to see so many of them that the rooms that we have blocked off as our negative airflow rooms, we have a tent set up outside, a negative airflow tent, and we have the capacity to increase our isolation area substantially.
Excellent.
Thank you, Doctor. And can you just speak really briefly on the importance of an individual not waiting to go to the hospital? I know, like you touched a little bit on some individuals thinking that the hospital is a scary place or a dangerous place right now. We know that the hospital is taking every precaution for that not to be the case. And can you just speak a little bit about, I know I've heard from some physicians that have told me about patients that wait too long. Can you touch on that a little bit, please?
Absolutely. If you feel you have a medical emergency, any symptom that's distressing you, you come to the emergency department, you're going to get a medical screening exam. Too many patients have told me, well, I had this or I had that, and I didn't think it was a big deal, and with COVID, I was afraid to come. It doesn't matter. Come and we will screen you, and then we'll know if you're ill, if you need further care. And again, because of the mechanisms we have in place to protect our COVID patients, to protect the staff, to protect the general public, we don't want people sitting there waiting with chest pain, shortness of breath, bad stomach pains. And even if you thought you just had a flu-like illness and now you're breathing a little harder, a little fast, or you see your child is breathing faster than normal or working hard to breathe, come to the emergency department.
Thank you, Doctor. And Dr. Garcia, can you, being that you're a certified family medicine physician, can you touch a little bit on how the virus is affecting different age groups?
Yeah, yes. First, I want to thank Dr. Hernandez and you guys with the testing. You know, one of our biggest challenges as physicians is diagnostics. You know, once I know what you got, everything else gets a lot easier. And you guys have been very quick about notifying me when my patients are positive, and from there we can carry on and take care of the patient, even if it's a telemedicine. You know, we're calling the patients every 2 days, and fortunately, most of our patients have been positive. We've been able to handle in the outpatient setting without burning too much Dr. Rodriguez or the ER department. But yes, I have several locations in Brownsville, and the makeup of those clinics are variable, and the clinics that we see a lot of elderly, those are the, you know, obviously our high-risk patients, as Dr. Rodriguez has stated. We handle most of those patients with telemeds, and we've been fairly successful at that. You know, my role as an outpatient physician is really to optimize all these patients' health. That's the best way that I can help keeping patients healthy and keep them out of the ER, keep them in the hospital. If I keep them as healthy as possible, if God forbid they get exposed and get the infection, that they'll be like most of my patients so far, being handled at home with not a whole lot of intervention. So we focus on optimizing health. I still have to take care of my diabetics, my brittle cardiac patients, and have to be available for all those patients. And doing telemedicine has been a good way of doing things, and keeping the patients out. We still have to see patients in the clinic, though. You know, we still have other infections. You know, last week I had 2 abscesses with MRSA I had to drain, other types of infections that I have to deal with. So some patients still have to be seen in the office, and we've been there available for them. And again, so not to burden our ER physicians and either in the hospital. You know, we select the patients that we can handle telemeds. We see patients in the office that need to be seen in the office. We've been very careful. We used one of our clinics to do COVID-19 testing. And so far, we've been fairly successful.
Doctor, I noticed that you are an expert in family medicine. Is there any advice? The one thing that we've been seeing in the numbers is that when somebody in the home tests positive, immediately we'll see every single other person in that home, including coworkers, of anybody that, you know, it is just a very extremely infectious disease. Is there any advice that you can give families? Let's say one person in the home tests positive. What do you recommend to isolate that person? What really can be done? You know, a lot of us we don't have the luxury of having very many extra bedrooms. What advice can you give us?
Well, obviously, what they taught us about social distancing is very important. Now, we've had a couple of cases of families, the whole family being infected in my practice. You know, that's after the fact. Part of the problem is a delay in the results of the testing. So by the time they get the results back, then we test the whole family. Well, guess what? The whole family is positive. So the best advice, if you're ill and you've been tested, then we practice social distances. You know, universal precautions. If we're washing our hands, if you're having cough and sneezing, you know, wear the mask. That will protect everybody else in the family. You know, the trick has been that by the time we get the positive testing, they've already exposed the whole family. So in general, is if you're feeling sick, you've got any symptoms, educating the family and patients. If you're sick, then start practicing the social distances, even in the immediate family. Washing your hands frequently. Don't share glasses, utensils, and if you are coughing and sneezing, wear a mask.
Thank you, Doctor. Dr. Zamir, throughout this process, we've learned unfortunately, that children and younger adults are not immune from this disease, from this virus. Can you touch on what it is that you're seeing at your clinic and in your practice with younger adults and children, please?
Yes, Mr. Mayor, thank you very much. First, I want to applaud our all great speakers on the panel, and most of all to you and the commissioner to talk about it. I will touch base from very beginning what happened, and I will help out a little bit more what we're seeing in our practice. As you know, we run an inpatient hospitalist program, pediatric hospitalist program. Going back when this pandemic started, it was a chaos from all the above authorities all the way down to local level. We don't know what's happening, what is it, what we are facing. It was invisible enemy, and we were confused. We don't know what we're facing. First, we thought it's a coronavirus. Coronavirus is very famous to give just upper respiratory infection for many, many years. Not a big deal. It's, you get a little sniffle, you get a little cold, and then you're better. And then, no, this was something different. We start seeing in Europe and China. Then we saw in New York. When it hit New York, that opens our eyes real hard. And from there, we saw that still we were focused, as CDC was focused, on upper respiratory infection, respiratory distress, cough, congestion, low-grade fever. And that's when we were focused and start testing those patients. From there, I come back to the city and, applause that, Eder, his team, with your collaboration, started the first testing center. And at that time, we were all panicked. We were making the committees right here and there in the hospital, and you were making the committees and being in touch with different committees in our hospitals, in our health department, and being online with the higher authorities. And I think I want to applaud, before I go to my pediatric part, is that we were the first one in Cameron County who imposed these quarantine and social isolation, and then social distancing, which is we call lockdown and quarantine afterwards. We were the first one who canceled the SPI spring break, which is a big deal for the kids, and they were very disappointed in us. And then we come down to our city and start testing over here. And that we were so lucky that our people listened to us very much. I'm very proud of people of Brownsville that they listen to us. And we are the city in the state that we have minimum positive cases. So coming back to my pediatrics, fortunately or unfortunately, fortunate that it's 75% or more kids will have the virus, but they don't have any symptoms. So we were the source to infect other people in the family, possibly our parents, grandparents, and goes to our aunts and uncles. At that time, our goal was to tell the families to stay home and practice, even if you are home, practice social distancing. Think yourself, just assume that you have the virus, and how you're going to protect yourself inside the house. And the best practice was to use the mask, even if you're inside the house at that time, I'm talking about March and April, use the mask, have a dinner table with 6 foot distancing, what we're doing in the restaurants now, and be helpful to each other, talk to each other, because that thing has affected us in emotional trauma and emotional reasons, which we saw in pediatrics more than the disease itself. We saw a few cases, as Eder reported, from 4-month-old to the 19-year-old kids that we took care of it. Most of our kids stays home. We have only few in the hospital that we took care of in here. And since we don't have pediatric ICU in our hospitals, so we end up transferring that patient from the ER to our sister's hospital in Harlingen and McAllen and to Driscoll Children's Hospital. As Eder talked about the symptoms earlier, that started with testing from upper respiratory symptom, fever, then we added diarrhea, vomiting, and the rash. In pediatrics, that was the first evolution. It was upper respiratory was more common. We saw the kids coming with diarrhea, vomiting, and they're not getting better because 24 hours, 48 hours, normal acute gastroenteritis with vomiting and diarrhea go away itself. You don't need to treat it, and if they just have a clear liquid. But we saw that it's persisting. And that time we considered, why don't we test them for COVID? And we're in a pandemic. Anything can be possible. And we start seeing that. So that's what we saw in our practice, upper respiratory symptoms. and a gastroenteritis. We did not see any rash. We learned about it, and we try to become very vigilant for the kids who are coming with different rash, with different viral diseases that in the pediatric. The rash is the most common symptom in pediatrics. So you cannot diagnose one kid just being on the rash, have a rash from other virus, corporate virus, but we become vigilant. We try to put the picture together. And the other thing that we just learned, that the New York governor has reported that they are seeing a disease, and everybody is very confused about that. Our community, our people, is that what is Kawasaki disease? It's not a motorbike. Like you said, I like to make joke. Yes, it's not a motorbike. It's a disease, and that we see in children for a long period of time. And it's very rare. We see them sometimes. We connected it after the infection with the streptococcal infection or any other viral infection. And that infection trigger our autoimmune system to start fighting against our own body. We call it mucocutaneous syndrome. That's what they start seeing in New York. And you heard about it, and Dr. Rodriguez and Dr. Mullane will back me up on this, or Dr. Family Practice Brother, that they were seeing a microvascular infarctions. We're seeing the necrosis in the microvasculature in our body, which gives us vasculitis. That's why the people are having a heart attack now with that. So that disease is do the same thing in the kids. So the kid's heart is very strong. What it does, this disease is inflame our blood vessels in our heart, in our kidneys, in the parts of our body, our skin, and have different kinds of symptoms. And that's what they are seeing, and we can assume that is possible. We have seen with other infection. Now it can be with the corporate. So we are very vigilant. We keep an eye, but we're very fortunate that we have only a carrier more than that. But our families have listened to us very much. We were available to do all the protection for PPE that you heard about it, from the hospital all the way to the clinics. All the clinics, all the offices, all the urgent cares, and freestanding ER, they have done a tremendous job by protecting their employees and protecting the patients who are going there. And I think that was plausible to all of our great team. Together, we can do it.
Wonderful, doctor. And this is why you're one of my favorite doctors ever. Of course, all of you are. Dr. Zamir has a special place in my heart. He's my kid's pediatrician, and we love him for that because he knows what he's talking about and he researches it and has the contacts for it. But Dr. Zamir, one of the things that I really, really applaud you for is, one, your availability to any parent that's having concerns or any child that gets COVID. We are so grateful to the care that you give to these kids who really, really need you. As a parent myself, what could you recommend to parents? A lot of us, our kids have been home for so long, which is unhealthy. They have been, in their rooms, doing school, doing whatnot, not leaving their home. What could you recommend to parents who want to say, well, let me take you to H-E-B. Well, let me take you to Walmart. Let me get you out of the house. Let me do something with you because I know that you're frustrated. What would you recommend to that parent?
Well, the first answer to that is no. Going to any grocery store or going out to the park at that time. Now we're opening up this kind of little changing pattern, but in reality, that was the worst thing that you can do to your child. So what I recommended, and it was a very difficult situation on the parents as well. The school is closed, the kid is there 24/7, and they have nothing to do. And the kid has so much energy. You know that, how they are in your kids in the place. They want to run around. They want to burn their energy. They want to be involved in anything. So what I recommended, and what I recommend now, is to start a kind of semi-school at home and the family reunion. Wake them up same way, 7:30 in the morning, brush, get ready, have a breakfast, sitting 6 foot apart. And after the dinner is done, do a little prayer like we do in our schools, and then start the homework. Give them the homework, and we'll start giving them online. Spend an hour and two for doing the work for school thing. And then after that, have a break. So the break, and then you have a lunch. And after lunch, you can have a little nap, and then you start playing, make them play a game. And this is the only time I say, give them 2 or 3 hours of video game instead of only one, In pediatrics, we recommend parents, okay, only 1 hour of video games, no more than that. But this time it was, okay, come on, give them 2 or 3 hours. It's okay. And then afterwards, when the time passed by at the end of March and mid-April, we saw a lot of kids say they've been in the house for all this time period. So they start having an emotional effect. They started crying, they were frustrated, they're having a temper tantrum, and some of them getting anxiety, and some of them, older ones, were getting depression. So I think that at that time we need to support each other. And at that time I recommended to do is you take advantage of technology, that what we're doing right now, FaceTime with your friends. Let them have an hour talking with their friends on FaceTime, and let them have a FaceTime with the grandparents, which they have not seen for 6 weeks or more. Let them interact, do a virtual hug. I mean, a hug is really a touch, but a virtual hug, feeling it, closing the eyes, just like what we do in yoga, we just feel it, and that makes your anxiety calm down. That makes your hormones inside, which comes from the anxiety and depression, calm down, and then you feel better. Talking is number one. And if anybody, because we saw a couple of cases coming to the office or in the ER at the urgent care with the suicidal thoughts, and so that is suicidal ideation, not the attempt, ideation. So we took that very seriously, and so I encourage the parents, if somebody in the house is having that kind of symptom, there is a hotline available for help, and they guide you. They guide you how to counsel them. They do the counseling on the phone. But the best thing before that happened is the communication. Talk to them. What are you feeling? What is your insight? Talk to me. What do you think about coronavirus? Then explain them what is the coronavirus and give them a hope. At the end, just give them a hope that it will be done. I don't know today, tomorrow, or day after tomorrow, but it will be over.
And Dr. Zamir, those are all amazing points, and I'm hoping that families listen to your advice. But to kind of segue a little bit on this, over the last several days, we've heard that BISD will be planning graduation ceremonies outdoors at Sam Stadium. I'm extremely concerned about that, seeing everything that I'm seeing and knowing where we are at this stage in the game for this virus. Do you have any concerns about that as well? And if so, can you maybe give some recommendations on how best to approach that?
I think that is a very sensitive topic. One group of people say that they are so scared about this virus and they want to save themselves and the people around them. Another group is like what I was talking about, is tired of being locked down at home. Since now the governor has released the lockdown and they're allowing the restaurants and places to be open. So I think we together has to do what you have listened to us in the first few months. Please listen to now. If you don't have to go out, don't go out. Stay home. Keep your parents, as Dr. Rodriguez was talking about, keep your elderly who have a chronic disease safe. How you can do it? By practicing what we were doing before. Now, recommendation for the ceremony, as long as they keep the 6-foot distance, as long as they have a mask on, as long as they will protect the people around them, it's okay. But what I have seen at the island on last weekend was not social distancing, and that was very, very disappointing. I think we need to go out and practice that, even though we know that it's flattening the curve, but we thought it's flattening the curve, but we saw increase in numbers in our hospital. We have 5 or 6 patients in each hospital before. Now we had 10 and 11 after this reopening, and we expected that. We knew that the numbers are going to rise because we're testing a little bit more, and then we're expecting that the exposure is going to be there. But we were prepared for that. And then I go back to touch the point on Dr. Mullane's point, that first we encouraged them not to go to the hospital because we didn't know what's going, and we don't want our hospitals to be overwhelmed, the ER packed with thousands, because I remember H1N1 in 2008, there were 300 people in my lobby outside in the parking lot. They wanted to be tested. 2008, H1N1 pandemic. So we knew those examples. So we said, you know what, first thing do, keep them home, keep them safe. But that message was perceived a little bit incorrect. that means they say, oh, don't go to the hospital. Hospital is a dangerous place. Now, we saw that some stroke patients, some chest pain patients, some asthma, respiratory distress patients did not go to the hospital. And then some surgeries, emergency surgery did not show up, like appendicitis got ruptured. And then they end up, and now they have to be more morbidity for a longer period of treatment. So we come back, when we learn that, we come back and we say, no. Hospital is very safe. The ER is very safe. We have taken all the steps. We have all the PPEs to protect the staff and you. So that message will be gone. And if we can use the same message to the graduation, and everybody play their own role and do with responsibility and diligence, I think it will be okay.
Thank you, Doctor. Dr. Mullane, you touched earlier on other countries and seeing, kind of the playbook from other countries and seeing what was happening in other countries, in New York and in other places. So we kind of see what's happening around, and we're on a delay, which gives us, in a way, an advantage on how to approach this. There's some individuals throughout the country and throughout the state that feel as though this is over, the worst is over. What are your thoughts on that, and what can you tell us?
My thoughts are that because our friends and neighbors, the citizens of Brownsville, did exactly as they were asked to do throughout the month of April, this is why we did not reach a peak and we did not become overwhelmed. Unfortunately, I do think we're opening a little too much too soon and not necessarily following as strict precautions as we should. And as a result, this is going to increase our cases. Now, I've seen many people argue that COVID will still only be serious in a very, very small percentage of people, and that's correct. But never before, even with H1N1, have we seen that many people that not only become seriously ill, but require ICU care and ventilatory support. And this is where one would worry about the system being overwhelmed. Thankfully, we're not at that point. We still have plenty of resources. We can handle an increase if it happens. We hope it doesn't, but we are still expecting that Brownsville has not yet seen its peak.
Thank you, Doctor. Commissioner Tetreau?
I'm checking my phone for questions, and one person is asking, do you recommend that people spend time in their yards? How about that? Is spending time in your yard safe?
Dr. Garcia, you want to take that?
Yes, definitely. Spending time in your yard is very safe. We know that we need sun exposure for vitamin D levels. I check vitamin D levels on all my patients. I encourage to have their vitamin D levels above 50. We know that improves and helps your immune system and modulates your immune system. It's an anti-inflammatory. There's the benefits of your psychological well-being. A lot of my telemed with my elderly is not necessarily medical, but just them talking to me. They're frustrated, being alone at home, not having anybody to talk to. So getting out sun, fresh air, as long as you're practicing social distancing, it doesn't mean you're going to have a group of 10 people there working on your garden. But definitely, if you're practicing social distance, go outside, go in your yard, get some sun exposure, get some fresh air, clear your mind. So definitely it will be a health benefit.
Thank you, Doctor. Dr. Rodriguez, we've heard you discuss chronic illness. We all know that the rate of chronic illness down here particularly is about 70%, and that certainly affects people's responses to this virus. Do you have any thoughts, or do you have any insight or knowledge on how far along the medical community may be on vaccine or any other developments on treatment?
Seems that the United States is processing a vaccine. Some other countries as well, China and France, are working on a vaccine. It's difficult because this is an RNA virus, and to do vaccines for this kind of virus is very difficult. It's expected that the real vaccine be approved for early January of next year. But there still is a concern that we can have a second peak of the disease at the end of the year when the winter come back. As well, we don't know if the immunity that the patients are having at this moment is going to be permanent immunity, or if the patients can have a second round of the COVID-19 disease. I mean, that still is are too many questions in the air that with the time will be clarified. But the idea is to have a vaccine at some point that we will allow the pandemic to end.
Thank you, Doctor. And Dr. Hernandez-Eder, I know you have 2 young children at home. You're on the front lines of this just as much as anybody is, especially with the drive-through testing and your own the practice that you run. But can you give us just a perspective of what it's like to have children at home and what kind of precautions you're taking yourself, and just the perspective of a parent with young children in the house that's in the medical community?
Sure. So we've with all the testing that we've done, we've over the 1,700 patients. You know, I have a specific model that I've developed to minimize the exposure at home. So when I get home, I have a special mat that has Clorox bleach in there, and that's where my shoes go. And then I go ahead and decontaminate in the garage and make myself into the shower before I make contact with my children. My wife, I'm lucky to have a wife that is she loves to clean, so she's cleaning and spraying all types of Clorox and Lysol and all these type of sanitizers. And it's great that we have proactive family members that understand that this disease is an invisible disease, as Dr. Zamir mentioned. It could be anywhere. It lasts on the plastics, cardboards, up to 2 or 3 days. So it's important to decontaminate surfaces. So specifically in our drive-through system, we have a special isolation gowns, and we have showers out at the sports parks facility where our staff members shower prior to coming to our facility. So we've developed a specific system to minimize the exposure. Thank God, none of our employees have tested positive for the virus because of the measures that we've taken. And so it is important to know that the virus is very transmittable. Like Dr. Zamir said, in the first 7 days, people are asymptomatic. And so we just have to be aggressive. As Dr. Zamir mentioned, and Dr. Jairo and Dr. Garcia, you have to take measures within your own home. Taking the measures in your own home just adds an extra level of protection. So obviously, if you come home with you've been exposed to the virus, and then you're hugging and you're kissing your children with a dirty scrubs or uniform, that's already a risk. So it's very sad when your children want to run to you, but you can't even touch them. You know, you can't touch them. You put your hands up and say not yet. So that's something that we all go through. But I think every household should have its own measures of protection. Whoever goes to the community for the grocery store, when they come back, is a potential exposure. So they need to be managed a specific way to prevent exposure to the family. Because we are seeing clusters. They're in clusters. It's the mom, the father, and the children are infected.
Thank you. Commissioner Tetreau?
So I just want to thank all of the doctors for taking their time to be here. We're getting so many questions and so many hearts every time a doctor talks on our Facebook Live feed. And just to make it clear, if anybody has seen me looking at my phone, I was trying to get the questions from the public. But we are so grateful to you, doctors, and we are hoping to do this again sometime soon in the future. I want to thank you all for your time. I know you have a lot of patients waiting for all of you in your waiting rooms right now. Thank you, Mayor, for putting this together, and thank you to the public who has been so interactive. Just to let you doctors know, we've had probably about 7 times the viewership of our city commission meetings during this live broadcast. So you all just touched thousands of people in the live view, and we are so grateful for your time and energy and everything. So Mayor, I'll hand it back to you.
Thanks, Commissioner. Yes, doctors, I really appreciate your time. The citizens of Brownsville certainly appreciate the frontline advice and a lot of the professional news that we're hearing from all of y'all here today. such a great panel. You all have wonderful expertise. I wish that we could go on for another couple hours. We easily could. I just want to be respectful of your time. There's probably going to be questions. If you all have Facebook, you can feel free to answer those in the response string. But otherwise, I'll leave you. Thank you so much. And thank you, everybody who watched. It's been great. This is wonderful. And thank you, everybody.
Mr. Mayor, may I say something?
Yes.
Absolutely, Doc.
Well, you know, you always recognize us, and we appreciate that very much. And you and Commissioner, but honestly, you and Commissioner and all your colleagues, Commissioner, especially you two, have done a tremendous job being engaged and being the captain of the boat. The way you have been interacting with our hospital committees or the city or state health departments around the state. We want to applaud to you all to how you have been supportive to us and love and care that you have given us, especially yesterday, the nursing day. We saw all law enforcement officers got together and they drove by the hospital applauding our nurses, and that makes them hope that they are appreciated, and they do, and they all love you very, very much.
Oh, thank you, Doctor. We are very grateful. We're grateful to hold our seats, and it's our responsibility to do everything we can in our power to make sure our community is safe. So thank you, Doctor. That means a lot to us.
Absolutely, Doctor. Thank you. That I appreciate your very kind words. And I can say when Commissioner Tetreau and I got elected almost a year ago, her several years, but re-elected a year ago, and me about a year ago, we certainly didn't expect to be in the middle of a worldwide pandemic, first in 100 years. But what I can say is we ran to serve. We are out there. We're engaged, and I do this because I love it, and not for any other reason. I'm going to continue to be out there and protect our community first. And thank you all.
Thanks, guys. Have a good day. We love you guys.
Thank you.
Thank you very much.